Hello, everyone. يعطيكم العافية. Thanks for joining us. We'll give people a few more minutes to join and then we can start.
Hello, everyone.
Hey, Rasul, how are you?
Good. I want to apologize to everyone, especially all of our candidates who've taken the time to come. I see Dr. Hardan, Dr. Muna here as well. I have a pressing family matter, so I'm going to be here just to kick things off, and then I'll step away. I do want to apologize to everyone.
Hello, everyone.
Hello. Hello. Hi, Muna. Miss you.
miss you كيفك؟
Hello.
Is everyone on the East Coast, or are people kind of spread throughout?
I'm on the East Coast.
New York.
Nice. Dr. Amro apologized a few days ago. He said he couldn't make it, so that means all of OBGYN falls on you, Muna.
Sounds good.
And I believe Dr. Dahamsha should be joining us soon. I just sent him the invite link again. Yeah, there he is. Dr. Shahid, Dr. Sayouf. I think that's everyone. We can give it a few more minutes for people to join. I do know this is going to be a very popular talk, especially. Yeah. Someone say something?
الو سامعني رسول
We can hear
Osama,
you.
please. Osama, I see you logged in two places. One's the picture, one's voice.
الو سامعني رسول
Yeah, we can hear you. Can you hear us?
okay, yeah. I'm just gonna use different accounts, one for video, one for audio.
Great.
Okay.
And Ranim, is that you recording?
Yeah, that's me. You can
Great.
stop your recording so that when you're gone, you don't have to
Yeah.
cap the recording.
Yep. I was saying this is going to be, I assume, a popular talk. There's a lot of interest in all three of these specialties. These are the most commonly asked, subs that people ask about. So hopefully it will be a great session. I think we can kick it off at this point. What do you guys all think?
I agree.
Yeah. All right. Well, again, I apologize. I did have a last-minute family event that's kind of pressing on me. So without further ado, I'll hand it over to the very capable hands of Dr. Ranim. And thank you all for taking the time to be here.
Thank you for organizing.
Take care. All right. Hello, everyone. يعطيكم العافية. Thanks for joining us. It's been, we've gotten a lot of feedback for these sessions, and hopefully we keep them coming and we continue to do more. If you feel like there's a specific specialty or a specific topic you want us to reiterate on, or you want us to talk more about, please let us know. We're all very easily reachable by Facebook, mostly. Again, أنا اسمي رنيم سعد. I'm currently a chief resident general surgery with Johns Hopkins Hospital in Baltimore. And I'll be moderating today. So we'll start kind of, because we have multiple specialties to talk about. We'll start by introducing the orthopedic surgeons. And we'll let each of them kind of tell us a little bit about himself and how they got into ortho and what their pathway was, and then we'll ask them some questions. So Dr. Walid, do you want to start?
Yes, sure. مرحبا كيفكم؟ الكل سامعني؟
We can hear you.
اوكي تمام. كيف حالكم؟ اول شيء شكرا كثير على السيشن هاي والاستضافه يعني. ان شاء الله نكون يعني نحكي شيء مفيد للجميع يعني. انا اسمي وليد الحردان. انا خلصت بلشت الميد سكول يعني بجامعه القاهره منحه. طلعت على جامعه القاهره على كليه طب القصر العيني بال 2003. بعد الميديكال سكول رجعت على الأردن، عملت الامتياز بمستشفى الأمير حمزة بوزارة الصحة. بعدين بديت على طول الريزيدنسي بمستشفى الأردن في عمان. عملت 5 سنين أورثوبيديك كالعادة يعني، وأول سنة كان جنرال سيرجري، وبعدين بتروح 4 years بعدين بتروح 4 years أورثوبيديكس. بعد ما خلصت الريزيدنسي في مستشفى الأردن I set for the boards البورد الأردني. ما عملت بورد عربي، كنت عامل البارت 1 بعدين I skipped البارت 2 لأنه ما كان مش لازم بالنسبة لي كان، فعملت البورد الأردني بال 2016. وخلال هذا الوقت أنا كنت مبلش بالبرايفت سيكتور في عمان في المستشفى الاستشاري، كان في عندي عيادة. بديت هناك وعملت 4 سنين هناك. خلال ال4 سنين هاي كنت اعمل اليو اس ام ايز، وعملت كل الستبس، ستيب 1 ستيب 2 سي اس او سي كي، بعدين عملت ستيب 3 كمان. خلال ال4 سنين هذول كمان عملت الشيء احنا بالاورثوبيدكس في عندنا شيء اسمه اي او سوسايتي، اللي هي بيسكلي هي سوسايتي interested بالتروما. فأنا كنت فاكولتي بالاي او تروما في عمان في الأردن لمدة 4 سنين. وخلال هاي الفترة طلعت الشيء بنسميه احنا اي او تروما فيلوشيب، طلعت على اورثو اندي هوسبيتال في انديانابوليس. عملت هناك تقريبا 2 شهرين. كانوا اي او بنسميهم اي او تروما فيلوشيب. خلال الشهرين هذول انا استغليت الاي او تروما فيلوشيب تبعتي، وهي شيء تريك او تيب للناس اللي بيحبوا يطلعوا فيلوشيب مثلا، انه انت طبعا دائما الكل بيطلع على الالكتيف او اي يعني some sort of elective او observation او any kind of rotation in the United States. طب انا بقترح دائما بحكي للجميع انه الاي او تروما فيلوشيب is a great path لهذا الشيء، انه انت بتروح تقعد you spend some time وكمان it counts as an elective او observership او whatever يعني، بتحطها بالريزمي. فانا هذا اللي عملته، عملت الستيب 3 هناك ورجعت على الاردن. وبال 2020 انا كنت مقدم على الاس اف ماتش للفيلوشيبس. اي ماتش انتو يونيفرسيتي اوف ميامي في فلوريدا. عملت اورثوبيديك اونكولوجي اند كومبلكس جوينت ريكونستراكشن فيلوشيب في يونيفرسيتي اوف ميامي جاكسون ميموريال هوسبيتال. سنه كامله كلينيكال فيلوشيب. بعد السنه هاي اي ماتش انذر فيلوشيب برضه اورثوبيديك اونكولوجي بمونتي فيور بنيويورك ان ذا برونكس. عملت سنه هناك. after this year برضه كنت عم بقدم على بالاس اف ماج انه بدي اورثوبيديك، بدي اعمل جوينت ريبليسمنت فيلوشيب او ارثروبلاستي adult hip and knee reconstruction. والحمد لله طلع لي I matched في University of Alabama in Birmingham UAB 1 year. عملت هناك ارثروبلاستي وريفيجن hip and knee reconstruction fellowship. خلال السنة هاي طبعا أنا كنت طبعا in the process of searching for a job، لأنه أنا كنت محتار أرجع ولا ما أرجع، وكنت حابب صراحة أضلني هون لأكثر من سبب يعني، منها أشياء عائلي بالنسبة لي، ولأنه زوجتي كمان she's an ophthalmologist, she's doing she did glaucoma fellowship here. We tried to get a job at the same place أنا وياها. يعني it's a long story، بس إنه بالآخر يعني الحمد لله يعني I got an assistant professor job ب University of Rochester ب upstate New York. وهلا أنا هناك. أنا consultant orthopedic surgery and adult hip and knee reconstruction. يعني mostly أنا بشتغل arthroplasty هنا و that's I just started here actually يعني 1 month ago. و that's it.
ما شاء الله, long road, بس paying off, and yeah, ما شاء الله. A lot of fellowships, Walid. Were
Yeah,
they
I mean,
all SF match? Is that the only way people can match into fellowships for ortho?
هلا الاس اف ماتش كانت اللي هي مونتي فيو بالنسبه لي كانت هي ذا اس اف ماتش 1. يونيفرستي اوف ميامي اول وحده يعني ما دخلت بالماتش انا الاساسي لانه ما كنت اصلا بدي انا اطلع بال 2020 عشان الكوفيد وكذا. بس يعني I got lucky يعني there was a vacancy through the SF match شفته, وفي كمان حدا من اللي هناك الفاكولتي اللي هناك اللي هو الدكتور معتصم المعايا اسمه he's a spine surgeon University of Miami. صراحة he reached out I think كانت أنا إجاني يعني text وكذا وغير هيك كمان على I think على اليور جروب هو حط كمان بتذكر وانا I reached out وكان في vacancy وثرو ذا اس اف ماتش كنت باعد انا اصلا كمان we got the match يعني فرحت هناك اول سنه وثاني سنه كنت اوريدي اي ماتش انه احنا بالاورثوبيدكس we match ما بعرف كيف بالجنرال سيرجري وبالاذر سبيشالتيز بس احنا قبل 2 years we match يعني you have to yeah so this is so I got the Montefiore lined up anyways. عملت ال UM fellowship بالأول then I went to Montefiore then through these 2 years تعرف بصير في عند الواحد connections و through the conferences وكذا I met a lot of people يعني أنا كانوا يعرفوا إني أنا interested بالspecialty اللي أنا بعمله ف I met someone through this guy يعني حتى يمكن تستغربوا يمكن أنا I reached out to him on LinkedIn actually. He started the fellowship in UAB in Alabama. وأنا هناك I went there and I spent probably the prime of my career يعني كانت in this year يعني.
ما شاء الله, that's amazing. All right, so let's hear from Osama and then we'll ask you both all the ortho.
مرحبا, سامعيني ولا مش سامعيني؟
سامعينك.
Good, كويس. أنا أسامة الدهامش. حاليا أنا أستاذ مساعد في جامعة القاهرة. جيت السنة هاي و I joined them. وليد, كيف حالك؟
تمام.
شو أخبارك؟ كيف أمورك؟ وليد هو كان معي في الجامعة أصغر منا ب 2 years و almost يعني the same pathway. So أنا خلصت من جامعة القاهرة وبعدين أجيت على الأردن. عملت 2 سنين as a GP بوزارة الصحة, ويعني كانوا شوي صعبين كثير, بس خلال هاي الفترة كنت أنا أقدم امتحانات. أنا كان معي تارجت إني أطلع على أستراليا, بس through the exams طلعت يعني أستراليا شوي طويلة مع الطريق تاعها, فأنا I changed during these 2 years وقدمت ال USMLE. بعد خلال السنتين اللي كنت بعملهم جي بي عملت ال USMLE Step 2 وال AMC, بعدين I joined the Orthopedic Residency في وزارة الصحة. خلال الفترة هاي أنا ما كان عندي معرفة بمستشفى حمد في قطر, بس تعرفت على شباب هناك وحضرت كونفرنس هناك وعجبني البروجرام, وكنت already معي Step 2 فقدمت له و I got matched there يعني كان كويس, وهي هي بداية الطريق فعلا. خلصت 5 سنين أورثوبيدك من حمد. خلال حمد, فترة حمد أكثر شيء كان مهم إنه نعمل ريسيرش, عشان يعني الواحد كان مخطط للأمام إنه يطلع على أمريكا. فكان معظم السي في building your CV على الريسيرش كونكشن. تقريبا من سنة ثانية أنا I decided to go for spine surgery, وكان الفوكس تاعي كله spine, والكونفرنس والريسيرش كلها around spine surgery. خلال هاي الفترة you build your connection. بعدين بدأنا نقدم على قدمت أنا اللي هو ستيب 2, قدمت ال CS وأخذنا لي CFMG, وقدمت ستيب 3. بعدين بدأت أقدم على الأس اف ماتش زي ما حكى وليد بالأورثوبيدك, هو أس اف ماتش الفيلوشيب هناك. فقدمت أول شيء قدمت على spine, unfortunately I didn't match. خلال هذيك السنة كان في لي my friend he's looking for a fellowship another fellowship فصح له اللي هي المونتفيور أونكولوجي قبل وليد أنا كنت هناك فحكى لي إنه he is not interested or he connected me مع البروجرام دايركتور I reached him out or we talked discussed and so يعني أنا حبيت البروجرام وهو he offered me البوست فلما offered me البوست كنت أنا سنة 5 كنت مقدم على النكست يير للأسف ماتش للسباين ف at the same week طلع لي الأونكولوجي وطلع لي السباين في يونيفرسيتي اوف فيرجينيا على الأسف ماتش طبعا عشان تكونوا بالصورة يعني حتى الأسف ماتش اللي طلع لي في فيرجينيا it was through connection يعني one of my يعني mentors he reached out to the program director باليونيفرسيتي اوف فيرجينيا and he recommended me وصار نصيب يعني فأنا I got matched بالأونكولوجي first year و second year I went to University of Virginia طبعا أنا my plan is to do multiple spine fellowship I applied again in SF match but SF match there is 2 university from Canada they already in the SF match of US واحدة منهم ال University of Calgary but I matched there وهي السنة الوحيدة اللي أنا I matched through the SF match without post match vacancy خلصت أنا من University of Virginia بعدين طلعت على كندا على كالجري خلصت سنة spine adult spine again بس كانت combined between neurosurgery و orthopedics فكانت a good experience بعدين السنة اللي بعديها وأنا بكندا هناك كنت بدي أعمل pediatric spine لأنه ما في عندي exposure للبيدياتريك وخلال واحد من اليونيفرسيتي اوف فيرجينيا he knows the program director in British Columbia and he sent him email and he recommended me وصار في عنا برضه meeting و I got there and I got matched Vancouver as a pediatric spine surgery. So I finished at the end 4 fellowships there. And at the end of my final fellowship كان في عندي post صح لي في chance opportunity إني أنا work in US. الشغلة الوحيدة إني أنا لما طلعت على US كان عندي ال H1B فيزا طلعت عليها مش على J1 فيزا. هاي طبعا راح أحكي فيها إذا حدا في عنده أسئلة حوالين هذا الأشياء كمان برضه. بس for family reason I got back to Jordan. I joined the Balqa University. I start my practice now بالprivate وبالبلقا University. يعني my point أهم شيء اللي بده يطلع على USA بالأورثوبيديك في عنا 2 pathway أول pathway إنه through the residency it's very very competitive there خاصة في الأورثوبيديك بس there's a chance it's not impossible but you have to do multiple years of research build your connection prove yourself في chance إنك تطلع في الأورثوبيديك هناك as a resident. إذا ما حصل لك بالريزيدنسي إنك تحصل هناك ال other chance through the fellowship. That's it.
Great. What an awesome achievement. Lots of hard work. والله يعطيكم ألف عافية both أنت ووليد. A lot of fellowships and a lot of training, especially after you've been trained abroad and you can't wait to be attending. And then you come back and do more training. How back to a quick question, Walid, because I also get a lot of questions from people in Jordan about who are doing ortho or have just finished ortho residency and are trying to come here. What do you think worked for you? And you mentioned the AO trauma fellowship. What else do you think in your pathway helped you get to where you are now? And what do you think didn't help that much?
Yeah, الكل لما طبعا of course يعني no question about it. You have to start with the USMLE. هلا بالنسبة للfellowship the score does not matter. Okay, ما فيش داعي إنه الواحد يتسترس himself وإنه يكون يعني يجيب يعني علامة كثير عالية يعني لأنه هلا الfellowship تختلف عن الريزيدنسي زي ما حكى الدكتور أسامة. الريزيدنسي كأورثوبيديك it's very very challenging. هلا أنا من الناس اللي دائما كنت أحكي impossible is nothing صراحة يعني بس انا بدي اكون واقعي شوي بهاي النقطه، عشان انا بخاف من انه في كثير ناس بيضيعوا عمرهم عشان يجوا يعملوا ريزيدنسي هون، وانا صراحه ضد هاي الفكره. هذا لسبب وحيد، انه الشانسز very minimal، يعني it's very competitive here. التوب students here graduates اللي هون they barely match into orthopedics. فانا بشوف انه الباثوي للاي ام جيز هي افضل شيء through the fellowship، لانه الواحد كمان ما بده، كمان انا بالنسبه لي مثلا وبالنسبه لاسامه، يمكن بدي احكي عنك اسامه معلش، يعني do you think you can go and feel as a resident again after like يعني all this؟ يعني انا بالنسبه لي مستحيل كنت يعني مثلا
And it's very difficult to go back like to do another residency. There, especially يعني orthopedic surgery is very difficult.
صح.
It's يعني the best chance for you as an orthopedic surgeon is through the fellowship. If you did not an residency there, if you want orthopedic.
Of course. يعني هو يعني back to your question رنيم، بالنسبة لي أنا what I thought helped was صراحة two factors. First, the experience اللي كانت عندي through the 4 years in practice that helped a lot. لأنه هلا it's not going to help anyone because I was looking for some kind of fellowships. يعني أنا كنت أدور على orthopedic oncology first وزائد الارثروبلاستي. فانا كنت يعني حظي شوي كان يعني حلو، انه مثلا هذول اليونيفرسيتيز اللي انا طلع لي فيهم، اللي هي اول شيء خلينا نحكي عن يونيفرسيتي اوف ميامي، في كثير في عندهم اللي هم الاوتونومي يعني كثير عالي كان يعني، فكانوا كثير بدهم حدا يكون شوي اكسبيرينس شوي. اوكي. فهذا ساعدني في الموضوع. they looked at my experience as an advantage يعني لما اخذوني يعني. when the same thing in University of Alabama نفس الشيء. الشيء الادفانتج الثاني اللي انا شفته صراحه كثير ساعدني هو ال AO trauma fellowship اللي انا عملتها. لانه I went to a really heavy high volume place they knew these people يعني. وكان الريكومنديشن ليتر لما تيجي، طبعا اي حدا بنطلب منه ريكومنديشن ليتر ما بيحبوا يكون ريكومنديشن ليتر from the US usually يعني. اوكي. بيحبوا يشوفوا اسماء من امريكا يعني. ما يعني هذا لا يعني انه احنا بالاردن يعني اقل منهم او كذا، بالعكس يعني. بس هم بيحبوا انه يعني it's harder for them to make a call internationally يعني و ask about you يعني when they have the chance to call someone they already know يعني. or they trust.
So Walid, does everybody in the ortho world know about the AO Trauma Fellowship and how to apply to it? Yeah.
بالأردن ال AO trauma هلا it's a society. started in Germany يعني بالأول. I think يعني زمان كثير يعني. وبالأردن احنا it's very well established يعني، وفي faculty بالأردن we teach mostly all the residents know about it يعني.
Okay.
وأنا I taught in courses the basic course والadvanced course بالأردن. I interacted with most of these people يعني، وكلهم كانوا interested بحسهم بالAO trauma fellowship. بس كانت المشكلة إنهم بيروحوا بدهم الAO trauma fellowship وهم مش عاملين USMLE يعني. this will not give you the chance to scrub in أصلاً يعني. In the US you cannot scrub in without the USMLE يعني أصلاً يعني. هاي it's an advantage يعني. كمان هلا في ناس بتروح observership على أكثر من بلد ثانية، بس I think إنه إذا أنت بدك الواحد يلعبها صح خلينا نحكي، يروح على نفس المكان اللي هو بده يعمل فيه الفellowship يعني. يروح مثلا لازم يروح على أمريكا يعمل الفellowship هاي. it gives him a chance أكثر من chance. أول شيء elective تعتبر elective قوية جدا. So you build the communication through it. 3 it gives you the chance to sit for the step 3 يعني انه step 3 is done in the US right. فانت هيك تضرب اكثر من عصفور بنص الحجر يعني. انا هيك كانت بالنسبه لي يعني الفكره يعني.
Yeah. Let me ask Osama. So just to kind of piggyback on the conversation we were having with Walid. So for applying to fellowship, you need to be completely ECFMG certified, including step 3. And when do you recommend people do it? During residency, مثلا, if they're planning on applying to fellowship?
والله يعمل USMLE as soon as possible صراحة يعني year 1 year 2 even before residency. And step 3, you can do it any year, and I did it in year 4 mainly. Or you have to do it to get
Before
the
applying.
fellowship. Yes.
Okay. And then
لا, but
the
I
question,
think just sorry for the interruption, but I think step 3 is Osama, correct me if I'm wrong. It's recommended for when you have the H visa, صح?
It's mainly for H1A visa because you cannot apply
Yes.
for it without.
بالضبط. But you don't need it to get a J1 visa, right? I think so. يعني it's مش كل الprograms they ask for step 3. I think it's an advantage to have it because you're applying for universities who sponsor J1 and H1B visa.
in general surgery, you can't apply to fellowships unless you have done your step 3. You need to be fully
okay.
certified. I bet it's similar.
Yeah, it's the similar.
I think it's similar, but you can apply. You can apply
You can apply, but you
through the
cannot
fellowship.
You cannot proceed to the fellowship without step 3.
I see. Okay. Good. Okay.
So, Osama, you mentioned something that you got 2 positions, one in the SF match and not one outside the match.
Yes.
How easy is that? I mean, yeah. Like, how can people do that if they applied through the match and didn't get something? Should they like start reaching out to program directors and ask for unfilled spots, or what do you recommend people do?
This is a good question. It's mainly like you have to know your colleague, the one who's already in US. They will tell you if there's any program, especially if there is any program starting a fellowship. هذول البروجرام بيكونوا أصلاً مش في الماتش أول سنة أو ثاني سنة.
Okay.
ما راح تعرفهم عن طريق الSF match. The only way to know is if there's someone know that and tell you.
Gotcha. Yeah. Okay. Well, we're free to get any questions through the chat. Everybody from the audience, please ask, any questions you want, and we'll move on to our next specialty. Thank you so much, Walid Osama. We'll be back towards the end of this session with more questions from the audience. Mohanna, do you want to tell us a little bit about yourself and your pathway to here?
Sure. مرحبا كل حدا، كيف حالكم؟ أنا اسمي مهند سيوف. تخرجت من الجامعة الأردنية بال 2012. السنة 5 قررت أعمل يورولوجي، فبسنة 6 طلعت شهرين إلكتيف على أمريكا، وبهالشهرين عملت ستيب CS. بعدين رجعت عمان وعملت سنة امتياز بالمدينة، وبهاي السنة خلصت ستيب 1. وبس خلصت سنة الامتياز طلعت على أمريكا، عملت ريسيرش لسنتين باليورولوجي. وبعد بعد السنتين دخلت على الماتش، قدمت للماتش تبع اليورولوجي، و I ended up matching بمستشفى اسمها لونغلاند يونيفرسيتي بكاليفورنيا. حنا عملت الريسيرش تبعي. عملت 6 year residency، اللي هاي الأيام كثير قليل ضل في residency 6 years بالمسالك. بس خلصت الريزيدنسي ب 2021، وبعدين عملت فيلوشيب سنتين باليورولوجيك أونكولوجي ب University of Southern California، وخلصتها بشهر 6 و I joined faculty بلوما ليندا University. هذا أول شهر ببلش فيه، this is my story.
Awesome. مبروك. Super competitive, mashallah. That's amazing.
Thank you.
So 6-year residency, most fellowships are 1 to 2 years. Is that true?
Most fellowships go from 1 to 2 years, yes.
Okay. So it's within the 7 to 8 years of a J1 visa.
It is, yeah, it does. You can apply for an extension if you're doing a fellowship, and they usually grant you an extension if you need to.
Yeah, because we often run into time limit issues in general surgery for people on J1 visa, because in general surgery, some people tend to do 2 to 3 years in the lab instead of just 1 research year, and then you end up running out of time on your J1. But this seems to not be a common problem in urology.
I don't exactly remember the cutoff, but I know that if you petition the ECFMG, it is not a hard rule, meaning you can get an extension to be able to finish any additional fellowship training.
Yeah.
And I think that should be a total of 8 or 9 years. But if you read the website, they say like they were considered cases on a case-by-case basis, which means they would extend it for you if you have the correct like paperwork for it.
Yeah. And correct me if I'm wrong, but from the very few IMGs that I've seen in urology, almost all of them came and did research here. Is that, you'd say, something that like a true statement?
Yeah, I think that is a hard fact. If you want to do urology, you have to be willing to do research. I don't think there is a pathway, regardless of how much you do on your steps, of getting into urology without doing research.
Yeah.
اللي بحكيه إنه urology has become more IMG friendly since I applied. I can see it, عدد الناس that are foreigners that are matching. More programs are willing to take on foreigners. They're getting more interviews, and they're received better than لما قدمت أنا. Downside is إنه عدد السنين الريسيرش عم بيزيدوا. و I think السبب الكبير فيها إنه هلا step 1 صار pass fail.
Yeah.
فلما step 1 صار pass fail, US graduates نفسهم who want to get into urology عشان يكون في differentiating factor بينهم وبين American students, كلهم مش كلهم بس most of them are taking a research year بس يتخرجوا. They either get funded من medical school أو they get support من حدا, و they stay on و they do a year of research. The downside of it إنه هلا إحنا بطلنا differentiating إنه والله عم نسوي منيح ب step 1 عم نسوي منيح ب step 2 عم نعمل سنتين research. فهلا معظم الريسيرشرز اللي عم بيسووه إنه عم بيقعدوا 3 و4 و5 سنين to get into residency بأمريكا.
Yeah.
بس once they apply صراحة يعني they are getting interviews. يعني foreigners are. I don't think it's impossible.
It's probably because you guys are good representation and programs are no longer scared of us. So thank you. All right. Thank you so much, Mohanad. Muhammad, you want to tell us a little bit about your pathway?
هاي أنا محمد شهي. أنا خلصت من التكنو بال 2009. بسنة خامسة I decided to do urology. So at that point I looked for electives. At that point it was never heard of IMG to match in urology. There was actually one IMG who I reached out to him, and he actually did 5 years of research before matching into urology, and his name is Dr. Jose Karam. So this is like I reached out to him. It's like as I asked him about his pathway, and he told me he did 5 years and 2 years of prelim surgery, then he got into the urology. At that point, he advised me to go to the American University of Beirut. So I did my elective at the American University of Beirut. So urology program at the American University of Beirut, it's one of the most established programs in the Middle East. It is like has been there for 40 years. Most of the graduates end up with fellowship at prestigious places in the US. So I did my elective there, and I was very focused to know what are my chances, what is my pathway, and what is the lifestyle for urology attending, because this is the most important time to learn if you want to go and continue with urology. So بهذيك المرحلة إنه I decided to apply for urology بالجامعة الأمريكية ببيروت. There is no direct match. I went for a prelim surgery. Okay, then I matched in urology American University of Beirut. It's 6 years program. During this, I did several electives in the US. I was heavy in research. Then I applied for the match, and I matched the University of Pittsburgh in urology. I did 2 years there. Then I matched into advanced robotic surgery fellowship at the University of Pennsylvania. After that is like for several reasons, is like I went back to KSCC. بالأردن, I worked there for 2 years and a half, and then I left to Dubai and I am in my private practice now.
Nice. That's awesome.
Thank you.
Yeah. Congratulations on all
Thank
your
you.
achievements. It's great. Sorry, it's my phone. Super competitive to get into urology, even at AUB. And then matching at Pittsburgh, was that, you said you only did 2 years? Was that like, did you match?
Yeah, I applied through the match. So we have a fellowship match for each subspecialty. So we have like a uro-oncology match, we have endourology match, and pediatric, transplant, and reconstructive, and sexual medicine match. So honestly, I applied for oncology and endourology. Now, to be honest, why I went for endourology, because my base in open surgery at AUB is very good, but it was weak in certain areas in minimally invasive surgery, and this is why, like, I wanted to focus on minimally invasive surgery. So this is why I applied for endourology. Now, UPMC, yeah, it's competitive. One thing worked very well for me, that one of the previous graduate matched at UPMC like several years ago, and he recommended me for the program director, and he knows the faculty at AUB. So all of this facilitated my transition from AUB to the States.
Was it through the fellowship match or was it outside the match? And
No, through the match, both.
the fellowship match. Okay, gotcha.
Yes.
Gotcha. Mabruk. So we
Thanks.
get a lot, question for both you and Mohannad. I get asked this a lot because I am in general surgery, but I did the prelim pathway, and I've seen a few people who come in doing prelim, planning to apply into urology after. For somebody who's a fresh grad, would you recommend they do this pathway or come here and try to do research and then apply to the match? How do you guys kind of feel about both pathways?
I think Mohannad, he's in better position to answer this question.
يعني I will speak on what I've seen. So it may be a very biased opinion on this topic, but anytime anyone asks me, I am extremely against prelim before getting into urology. Because for a few reasons. The reason you do research is not just to publish papers, it's for connections. You need a program director and a chair that knows you, and you need their support when you apply. For your highest chance of matching is a program you do research on that has consistently been proven over the years. Most IMGs that match end up matching at the program they do research at. And number two is you need them to know you well عشان يحكوا مع program senior to tell them we like this person, give them a chance. If you do prelim, you're out of the circulation. ما حدا بيعرفك بالurology. You don't spend time on urology, and probably Raheem can speak to this, but the programs that I've seen, prelims are not the most favored in general surgery, but they're not put on the rotations that they want or choose. But you may have a hard time getting on urology. And the third issue is if you are on a J1 visa prelim, this starts your time. You have a clock. تبلش الساعة عليك. You cannot stay on a prelim position على J1 visa. You do أول سنة prelim, you do سنة تانية prelim على J1 visa. But then at this point, you either get into a categorical spot أو ببساطة تروح على عمان. لأنه the prelim J1 visa, you cannot stay in a PGY2 position زي الأمريكان بيسووا. الأمريكان بيروحوا PGY1, PGY2, بيعيدوا PGY2, بعدين بيروحوا بيعملوا ريسيرش بيرجعوا بيعيدوا PGY2. J1 visa بتمنعك من إنك تعمل هيك. But at least for someone who really بده يعمل urology, I highly advise against the prelim. Downside تبع البريلم إنه كمان you're busy. فمش فاضي تعمل ريسيرش، مش فاضي تختلط مع الناس، عم تاخذ نايت كول، عم تاخذ شيفتس. فيعني I think it takes you out of circulation. كثير تعمل لك disconnect عن الurology.
And you lose pleasing either. The prelims who are not really focused on general surgery are not really, well liked in general surgery.
Even if you get great letters من general surgery, I don't think it goes much. يعني it has to be a urology support.
Thank you. Mohammed, question for you. What are the how many years do you need to work in the US or do fellowships to be board eligible in urology if you finish training elsewhere?
Okay, so this is a very good question. So usually in the past it was very difficult, but now with the shortage, now there is a clear pathway for people who didn't do their residency in the US. So they have to serve 7 years in academic practice, okay, and they have to prove record of publication and engagement in medical student and resident teaching, so they can sit for the board.
Okay. And those 7 years, they start counting from the day you start fellowship.
No, 7 years as faculty.
But how do you get the
Before,
faculty job if you're not board eligible?
so in urology, you can get waiver for this in certain academic institutions. The other thing is very important to know that in the past, you have to be professor, then you apply for the board for IMGs. Now, it's a little bit lenient. One thing very important, they mentioned about J1, H1 for people who going to the fellowship directly is one reason is I was looking for H1 position, so it gave me more flexibility. The other thing, most of the programs prefer, surgical program prefer H1 visa actually for billing issues. So as fellow, I had like clinical instructor position. So I used to take calls as an attending. I do my time out. I can bill for surgeries. So this is the key. So without step 3, you cannot, you will not be able to bill and you cannot get H1B visa.
Yeah, great discussion. Thank you both. All right.
One thing I'm seeing on the chat a few questions like pertinent to the urology. Yes, urology has a special match. So it's different from the regular match, and the timeline is different. I think Muhammad, he can answer this question. They are asking Muhammad, how can you get a research position while you are in Jordan? Is it easy? Is it difficult? So Muhammad will touch on that.
Yeah, we were gonna answer everything in the chat after everyone's done so that they can.
Yeah, we can do that. Okay.
Yep. So without further ado, Dr. Makhamre, floor is yours.
Thank you, Raneem. Also, everybody on the call, impressive work. اسمي منى مخامرة، تخرجت من الجامعة الأردنية ب 2018 وأنا هلا currently chief resident ب Maimonides Medical Center in Brooklyn, New York in obstetrics and gynecology. Brief about me and نعطيكم background عني. دخلت medical school and I didn't know what I wanted to do, but I knew I wanted to pursue residency in the US for several reasons. I took it upon myself that بعد سنة رابعة بكون عندكم شهر قبل كل سنة. فأنا due to I have family in the US كنت كل شهر أروح أعمل observership in whatever I could get a chance of. بس بين السنة الرابعة والسنة الخامسة عملت شهر ب MD Anderson observership. بين السنة الخامسة والسادسة عملت كمان شهر observership ب Boston Children's. None of them are in OB. This is just to build something in my CV as a start point. وبالسنة السادسة عملت 2-month elective in obstetrics and gynecology بكورنيل. عملت شهر gyneonc وشهر MFM. Then بس خلصت هناك عملت الconnections، تعرفت على several people. I had a mission in my mind إني أنا بدي أعمل research after I'm done with medical school. وقبل ما أطلع على elective كنت مخلصة step 1 بسنة سادسة. I made it a mission where I أول شهر بالgyneonc I already had a connection for possible lab in gyneonc research. The second connection was research in MFM clinical research. فluckily بعد ما تخرجت من الجامعة الأردنية بعد بشهرين قدمت step 2 after that I moved to Philadelphia. I joined Thomas Jefferson University for research in MFM and genetics. وضليتني هناك لحد June of 2020. بشهر 9 2019 قدمت على الماتش والحمد لله I matched at the same year. وبجولاي 2020 بلشت my residency. My pathway is similar to Muhannad, where I did research before I applied to residency. OBGYN, the main things that I can say is you need to show that you really have a passion towards women's health. So just getting high scores is not enough. At a baseline, you have to have you have to pass your USMLEs and have a good score. You don't have to have an exceptional score. You have to show whether you do volunteer work, but most importantly, research, because OBGYN is very, very competitive. In the past few years, it's been more competitive, but still بقدر احكي انه في كتير ناس IMGs عم بشوفهم still they match. بالاحرى مش من الاردن بس في كتير ناس whether من مصر او من لبنان عم بشوفهم او بعرفهم they matched. almost always الباثوي كان عملوا research بعدين دخلوا residency in OBGYN. والإشي الثاني اللي لازم تعرفوه OBGYN إنه لما تعملوا research you're not just building, it's not about papers. Nobody cares when you apply for residency, especially surgical specialty, nobody cares about your research. They want somebody to do work. But what that helps is that distincts you. It shows that you have what it takes to have dedication towards what you want. It shows that you know people and you connect to people. And I wouldn't be matching if I didn't make the connections that I made through research. That's number one, because I went to conferences, I met with many people, but also I had a mentor who I did research with who also advocated for me and made calls to make it happen. But at the end of the day, it was really, they can get you to the door, but يجبروكم الانترفيو حتى. But as you fail your interview, you're not going to get ranked. So that's what you need to keep in mind. And research was used for a way to make connections. That's the most important step. It was used to have something special in your CV that is distinctive from any other medical student from the US who's applying. لأنه all medical students, what they have is letters of recommendation. They have their shelf exams, or they might have 1 or 2 papers maximum. While when you're an IMG and you do dedicated research time, you don't only have papers, but you also have posters and abstracts, and that also distincts you. And this is also something you build if you want to pursue fellowship. I would say my research years have helped me more in fellowship rather than residency simply. And أنا هلا بخلص ب 2024 in June, I'm going to be moving to Texas. I'm joining Baylor to do fellowship in both maternal fetal medicine and medical genetics and genomics. So it's a combined fellowship. It's a total of 4 years. I'm on a J1 visa, but I'm going to be also applying for the extension as well. Mind you, to know, but research, the good thing is I was on a J1 visa, but research, but it wasn't sponsored by ECFMG. It was sponsored by Thomas Jefferson. It wasn't counted from the years of the alien physician. And you can do up to 5 years of research as a research scholar sponsored by the institution that you're at. Technically, you can have 5 years in addition to the 7 years of residency training. So you don't have to have a US passport or a green card. I'm somebody who had neither, and I did it on a J1 visa. I would say if I would recommend something is OBGYN, if you do end up matching in OBGYN and you're on a visa, OBGYN residency is 4 years. Most fellowship in OBGYNs are 3 years. If you start on an H1B visa for the first 3 years, you will run out of time because it's almost 6 years. That's one of the things that my colleagues who are also on visas went into trouble. So I would say J1 is more ideal for training in visas in residency.
Yeah. Well, thank you so much, Mona. Congratulations on your recent match. Mona is one of the smartest people I know, so thank you for joining us and telling us about your experience. So you mentioned most people come on J1 visa. Are there even any programs that offer H1B? And would it be only ideal for people who don't want to pursue fellowship because that's the only way you can support being on an H1 and doing a 4-year residency?
That's a good question. So my program actually sponsors H1B visa, but I didn't have step 3 in time. So my colleagues, they matched, they're on H1B visa, she's an IMG. She matched into UroGyn at Mayo. Right now, I don't know what's the visa situation for her going to be after she's done with the 6 years of H1B visa. She might apply for a green card. They might sponsor her green card application. But that's not always the case. I have another colleague of mine who's applying for GYN-ONC. She will very likely switch to a J1 after doing the H1B visa because they might not sponsor her H1B visa again and then a green card.
Yeah, that sucks for her.
Yeah.
J1 is
still-
one of the most complicated visas. As someone on a J1, I recommend you try your best to do anything to avoid being on a J1, but sometimes for training purposes, you have to. Yeah. So, question. So, Mona and Mohanad, you both came here fresh, out of med school and did fellowship and did research fellowships here or postdoc. Lots of people ask me, this is like extremely common question. How do you get a research spot? And what do you tell people, paid, unpaid? How do you get a spot? And should you get any research position or try to get one in the specialty that you're planning on applying into?
I'm going to leave the floor first for Mohanad to start and then I'll respond.
I'll tell you my experience. أنا اللي عملت elective I stayed in contact with both places. I did an elective B Wake Forest in North Carolina وبعدين I did an elective B Lowell University at both departments. وأنا هناك because إنه I made the decision بسنة 5 إنه I want to apply to urology بأمريكا. فالمايند سيت لما وصلت هناك إنه I knew لازم أعمل research ف I stayed connected مع الفاكولتي هناك. فبسنة الامتياز ما قطعتهم بس روحت. كل مدة ومدة I'd reach out. I knew كان عندهم research position. I knew it was filled. بس لما الوقت إجا وكان بالresearch position ترك أنا أول واحد بعتوا لي إيميل حكوا لي في عنا research position is opening up. وحتى أول when it opened up كان بنص الامتياز لما كان بشهر 12 وحكوا لي تعال بتيجي بشهر 1. كان شغلة صعبة إنه كنت بلشت أفكر هل بترك الامتياز ولا لا. بس وقتها كان موجود قرار to extend فصفيت مبلش بشهر 7. So I think the best way إنه يكون عندك connection مع بني آدم هناك. أنا قدرت أطلع elective. بعرف في ناس ما بيقدروا يطلعوا elective. Alternative يكون عندك connection حدا بتعرفه. Reach out to someone بأمريكا بيعمل urology لأنه ما بتعرف يمكن يكون عندهم position و they can connect you عشان تعمل research.
Yeah. Thank you.
Similar to مهند أنا لما أنا أول ما عملت النسائية وتوليد بالجامعة الأردنية بالسنة 5 عرفت إني خلاص بدي أدخل نسائية وتوليد وعرفت إنه I'm gonna do this بأمريكا إنه قررت فلما عملت كان it was a mission for me to do my elective in OBGYN so that I can find it. الelective ما كانت لأي شيء سبب عدا عن بدي ألاقي research position. That was my main goal in my elective. فمن أول ما وصلت أمريكا كان my goal إني I looked at الwebsite. I looked وين في labs بال OBGYN department. I contacted each PI of those labs. I got in contact with one of them that I was doing serial interviews with. But it was my sponsorship with for that research position was dependent on if they get the grant or not. They didn't get the grant and they were not able to sponsor me. But I did it in parallel. I don't want to put all my eggs in one basket. فكنت عم بعمل كمان I was communicating with a doctor that I met through my elective. I wanted to do research. And one of the things that you need to know إنه أنا ما كنت عملت research project معك. كنت بشتغل معك بأردن and didn't yield anything. But it was one experience that I could speak of. بس كمان عملت research مع دكتور مأمون أهرام. But and that was the only thing that I had in a physical على my CV that could show this attending إنه I want to do research. I kept on communication with her بس خلصت أنا خلصت بشهر 3 حتى my elective ودغري بعد بشهر 3 أشهر تخرجت من الجامعة الأردنية وبعد بشهرين رحت على فيلادلفيا it was a very short time interval ضليتني in connection معها ودغري طلعت فأنا ما عملت امتياز بالأردن. وماي position.
Sorry, Mona. Just please continue, Mona.
No worries. I was saying my research position was unpaid. للناس اللي عم بيسألوا في places that do have research positions that are paid. It all depends. People who get paid during research, it depends on the PI attending if they have grant money to support you getting paid. So I think that's one of the things. أو if the institution كتير معها مصاري وبتعطي research as an official position. فأنا بالinstitution اللي كنت فيها didn't have much money. Because it's clinical research and it's not basic science research, there's not much grant money to give for clinical. it's costly to spend it على a person. Or يعني I was able to, it was only I need to support myself financially for يعني السكن والمعيشة اليومية. و these things يعني you can always find a يعني ما هو إذا أنت رايحة على جامعة فيها medical school, you can always room in with medical students. That's possible, or not necessarily. Philadelphia is not very expensive. It is relatively expensive, but you can find ways to minimize expenses. But at the same time, it's still an investment. Yani you consider it, this is a personal investment for your life.
Yeah, it's tough. It's tough. Muhammad, you were going to say something.
أنا in position in my career إنه I was lucky to mentor several people who match into urology from American University of Beirut. وفي ناس هلا من عمان same thing. For anyone who's applying for residency, I think it's very important to use the time in med school to sharpen certain skills, soft skills, like learn how to write a grant. It's not about publication, as Mona mentioned. Just show that you know how to write a grant. You know what is IRB application. During my med school, I filled 3 IRB application. None was like ended up in publication, but you know, it's process. You are building these skills. The other thing is after Corona, there is now a lot of labs offer virtual research positions. So, for example, Cleveland, they have research and urology lab that has like several virtual research assistant there. So this is something you can look into it. So you can do research in Amman, while you are in Amman, and you can get publications. So this is a way that will facilitate future research positions. Other things, look for certain programs. One of the most important programs that I saw residents and students in AUB do it is called SHARP. It's now you have the online SHARP course and you have the in-person course in AUB. It's 6 weeks dedicated course for statistics. Honestly, most of the people who did this course from American University of Beirut, and I know 2 people from Jordan, they ended up matching in surgical subspecialty.
Yeah, I recommend, I get asked a lot about doing any statistics course, and I always recommend, you know, any knowledge is better than no knowledge, and it's something you can add on your CV and shows dedication to research. Speaking of research, going back to Walid and Osama, I get asked this a lot because ortho fellowship is extremely tough for, you know, I have a lot of friends who did ortho residency in Amman, and they're trying to come here and do fellowship, and they've applied to the match multiple times and didn't match. And I always tell them, why don't you come and do research? And obviously it's, you know, as someone who's just finished residency, they don't want to leave clinical and come and do research. Does this really help them get into the SF match the next year? Do you recommend if somebody doesn't match for the fellowship match from residency, what do you recommend them to do?
هو صعب كثير فعلا انه after you finish your residency to go for a research.
Yeah, ما بتخيل.
Already it's very difficult. It's worth it if you need. If it depends on your goal. You want to stay in the state, or you're just gonna do some fellowship in the state and come back. This is both pathway is different how to approach them. بس أهم إشي للي بده يطلع فيلوشيب للأورثوبيديك، إحنا زي ما حكت منى مهند ومحمد حكوا الريسيرش is not about the research itself. It's to build your connection, build the skill. Even if you have just only 2 research, like 2 articles or 2 published articles, they know that you know how to do research. This is one thing. The second thing is, if you're doing research, try to choose with whom you are doing your research. مع مين أنت بتعمل research. هذا important. يعني a lot of students, they are doing their research in Jordan. They are not building any connection. It's a wasting of time, really. You are doing a research and you are publishing it in a very national journal or even a journal not pub-indexed. لا الBI ولا any of the co-author known outside. This is important to know. Now, how to build your research? You can build your research by connection. If you can do يعني أنا بنصح اللي إذا حابب تعمل research after your residency, you can try it at least 1 year. But I have my friend who did a 1 year of research. After that, يعني he built a good connection and he got a lot of fellowship after this. And I recommend that if you didn't match.
Yeah, might be worth it.
Yeah. The other thing I'm proposing إنه أي حدا على الchat participant he want to involve in research in Jordan and I can build we have a team, national or international. He can reach me out anytime and I will help.
Okay, great. Thank you. There you go, guys. Walid, question for you. Is there like a rule of how many years you need to kind of practice ortho in the US before you're board eligible? How do you get there? And do you need your board to get your first attending job, or is it similar to urology where you can get your job at specific institutions? I think you're muted. Or we can't hear you. Take your time, no worries. The other thing I saw a bunch of people on the chat asking is the difference.
If Walid مش I can answer this point here.
Yeah, please go ahead.
For board eligible in US يعني عشان لما تطلع fellowship في عندك 2 pathways. One pathway is to end with board and to get the USA orthopedic board, أو to get the green card and stay in the state and board. The first pathway is you have to do your fellowship. It depends on the state. Like أول خطوة you have to get the license, full license. The fellowship, it will get you a license.
Hello.
The state, and for example, in New York, New Jersey, I think they need a 1 year of fellowship, and then after that you can get the full license. Other states they need 2 years, others they need 3 years. So that's the first step, get a full license. Second step is to find institution which sponsor you. علشان توصل للبورد اللي هو الباثوي للبورد, you have to be a faculty in an academic institution and they support you, sponsor your visa. You have to work for 5 years in a faculty position until you reach, I think, associate professor. After that, you are eligible for board. First pathway.
That's right.
The second pathway, if you want to stay in the state and work, then you just have to find an institution that sponsors your visa and stay there.
Yeah. I need to find.
Thank you, Osama, for bailing me out.
That's okay.
Yes, I'm going to echo what Osama just said. You can hear me now.
We can hear you.
Okay. هلا بالضبط زي ما حكى أسامة exactly. هلا في الأورثوبيدكس هلا في كثير شغلات الواحد لازم يفصل عنها. الناس بتفكر إنه اللايسنس زي البورد أو البورد زي اللايسنس. They are very different يعني ما هم يدخلوا ببعض. هلا لما الواحد يبدأ بده جوب يعني أول شيء you have to look which state. Every state has laws زي ما حكى أسامة. هلا بالنسبة إلي أنا لما كنت أدور مثلا هلا اذا بدنا نيويورك ستيت مثلا خليني احكي انه هاي اللي انا بعرف فيها زي ما حكى اسامه 1 year is enough. بس اذا كانوا بدي يعطوك I think institutional license. هلا اذا if you want to get a full license for a full license, which means you can not only practice in your institution but you can practice in the community hospitals affiliated by the university زي اللي أنا بعمل هلا فيها. أنا عم بشتغل in the main hospital زائد community hospital, so I had to apply for a full license. For a full license, applicants who didn't graduate from a New York State registered accredited medical program زينا هذا بالأردن مثلا إحنا مش accredited. They must complete at least 3 years of postgraduate. Sorry, اللو تاعهم you have to complete 3 years of postgraduate training in an accredited residency program. هلا you cannot do that انه احنا already عملنا residency بالاردن. فالحل بالنسبه لنا انه الايكوفالنت للموضوع هذا بالنسبه لهم للبورد لما يقعدوا يطلعوا اللايسنس الابروفل وكذا they need 6 years of practice. هلا هاي 6 years كيف تنحسب؟ مثلا بتنحسب الفellowship تبعتك هاي اللي احنا عملناها. كل fellowship it's a year. This is a year. Another fellowship is another year. امتياز is a year. Practicing in Jordan and private practice is a year. فبحسبوا لك اياهم in total, then they sit as a board committee or they approve you. Usually 99% you get approved. لانه اللي بيلعب الدور هون مش بس الستيت، يعني الباور تبعت اليونيفرسيتي كمان هون إلها كثير وزن. يعني لما واحد تقتها، عشان هيك دائما احسن شيء الواحد يدور على يونيفرسيتي هوسبيتال ان هم اللي عندهم الباور تو get you the license وعندهم الباور to sponsor you with the visa. لانه as you said J1 يعني شيء كثير سيء. انا كنت على J1 but then I had to take the J1 لانه البروجرام كان بالنسبه لي بديش اخاطر فيه، كان a very strong program.
Yeah.
ACGME accredited so I couldn't take the H1B. فانا went for the J1 وعلقت في J1 ومرتي نفس الشيء صار فيها بالضبط. يعني فاحنا الاثنين علقنا بالجي 1 وكان هلا الحل انه يا ارجع الاردن اقعد اللي هي 2 years role بتاعتهم وارجع which it wasn't يعني it doesn't make sense to me. انه اذا بدي ارجع الاردن كان خلص رجعت ضليت بالجوب ليش بدي ارجع هون. او مثلا الحل الاخر هو الجي 1 waiver. والحل الثالث اللي ضبط بالنسبه لي هو I got an O1 visa. So the university sponsored an O1 visa for us. وهذا اللي كان البيل اوت من الجي 1. بس برضه it doesn't take the J1 waiver off you. so انا eventually بدي اعمل J1 waiver واخلص منها. هلا بالنسبه للبرو كيف واحد يصير sit for the boards you need 5 years of training in the university setting. يكون في residents حواليك, fellowship, you train fellows, you train residents, you engage in ground rounds, you do publications. برضه في papers تطلع كل سنة at least a paper or two. فهاي الأمور كلها بتطلعوا عليها. after 5 years you get you can set for the board whether you're a professor or an associate professor. It doesn't matter يعني بالنسبة لك في الأورثوبيدكس. هذا يعني nutshell يعني الموضوع اللي بعرفه أنا.
Yeah. Well, thank you so much. There a bunch of people asked about doing research on a J1 visa. It doesn't count towards your years and you don't have to do a waiver. So you can come here and do, straight out of med school and do research on a J1 research visa that's usually sponsored by your institution, like Mona said. And then after that, you can apply to residency and either apply to H1B or J1 programs. You can switch after research. That's you can.
Yes, and the J1 clinical is very different than the J1 research.
No.
But you can if you're on a J1 clinical, I don't think there is a way you can switch to an H1B. It's impossible. I looked through these يعني وسألت lawyers يعني ودخلت القصة هاي كثير it was impossible.
Yeah.
So if you were on a J1 research, yes, you can do that. It's another category أصلا.
Yeah. So just بس إنه أأكد على الموضوع إنه research on a J1 visa it's the category of the exchange J1 visitor is called research scholar. It is very different from the alien physician status that is sponsored by ECFMG. The one that is sponsored by ECFMG, because it's an exchange program, the whole concept, that's why there's a 2-year rule. You are sponsored by the fact that أنت بدك ترجع على بلدك to improve بلدك. That's why there is such a thing by this sponsorship. The 2-year rule is only for alien physician that's sponsored by ECFMG. A research scholar, this is institution dependent, and you can renew it up to 5 years. While the J1 visa on an alien physician sponsored by ECFMG, it's up to 7 years. But as we said before, you can also apply for an extension based on your fellowship. And that fellowship also needs to be ACGME accredited. That's one of the rules. Also,
and you can have a separate session for visas. I know everyone is lost.
Exactly.
Mentioned 1,000 different visa combinations and things you can do and loopholes. And this is why we're going to have a special separate session just for visas and immigration. Hopefully trying to find an immigration lawyer who would come and help us out with it too. So
I just
to
add one
clear the
comment to that,
confusion.
About the visas. So the reality is when the time comes and if you match, يعني it's not, rarely will it be your decision شو الفيزا. الصراحة if you match into a surgical subspecialty راح يجوا يحكوا لك this is your visa وانت راح تحكي okay وهم take care of everything for you. فالناس اللي عم تشوف على الشات بيحكوا confused ومش عارف شو اسوي. The reality is إن هم راح يعملوا لك إياها وهم they'll make the decision وهذا الباث تبعك راح يكون. ف don't worry too much about الفيزا. حتى الجي 1 يعني أنا على الجي 1 وبعتبرها أسوأ شيء بالعالم. بس واحد فاكولتي هون تعرفت عليه كان على الجي 1 وخلص أموره وهذا كان يحكي إنه في 100 obstacle بالفيزا سيستم بأمريكا بس في 101 solution which is true. يعني حتى بالجي 1 يعني أنا هلا بطلع حالي بحكي أسوأ شيء بس صار لي أنا 8 years خلصت على الجي 1. يعني aside from إني أتغلب شوي بالسفر يعني ما أثرت كثير على حياتي هلا. يعني I still got the position I'm still working. فجست خلوا هذا in mind إنه هم راح to make this decision and they will take care of it for you.
Yeah, good, awesome. A couple questions about work-life balance for urology and ortho and OB. You know, these are all surgery subspecialties, so it's going to be difficult. And you know, feel free to add, but you know, if you're doing a surgery subspecialty, you know, rounds are at 5:30, cases are at 7:30. There's emergency cases, there's takebacks, there's complications. You know, when you're the surgeon in the future as the attending, you know, the patients are your responsibility. Whatever happens to your patient, you have to come back and take care of it. This is not shift work. This is not group work. This is a little bit different than non-surgical specialties. So please add anything I'm missing, guys.
أنا الكومنت الوحيدة find a good mentor. This is very important. If you find a good mentor, he will help you in your pathway. وبعدين بالنهاية زي ما حكيتي المريض بتزوجك احنا بنسميها خلص.
بقدر أحكي عن الورك لايف بالانس من الأشياء اللي أنا ما كنت كتير عارفة عنها. يعني أنا عارفة بدي أدخل نسائي وتوليد وكنت يعني عارفة إنه كتير ناس رح يحكوا لكم بالنسائي وتوليد especially اللايف ستايل رح تيجي 3 الصبح تولد مريضة blah blah blah. بس in residency training especially in the US most residency programs have a night float system. فأنا at least بعمل 10 أسابيع night float every single year. That's one thing to take it. وmy night shift that means أنا ببلش على 5 المساء وبخلص 8 ل 9 الصبح 5 days a week. يعني أنا لما أدخل night float ما بشوف زوجي ل5 أيام كاملين لأنه هو بيروح الشغل برجع ما بشوفه. That's something to also to keep into consideration إنه if that's something you want to do, surgical specialties in general are not easy lifestyle especially in residency. بس حتى later on for fellowship يعني أنا when it came to بعد ما خلصت residency training أو during يعني هني final year one of the things that why I'm applying I knew what I want من الحياة إيش بدي in terms of work-life balance. Maternal fetal medicine is one of those that are less heavy in terms of say gynonc for example where gynonc anytime they can call you in the middle of the night for a complication for one of your patients. Urogyn is better lifestyle لأنه it's just scheduled cases but the surgery is run for a very long time. يعني بدكم لازم يكون عندكم more insight على إيش بدكم وحاولوا قد ما بتقدروا تسألوا احكوا مع ناس تسألوهم details. يعني مش بس السؤال كيف رحتي كيف وصلتي إيش الستep سكور تاعك إيش الفيزا بس اللايف ستايل. ask what's your day to day like لأنه that's what you really don't know and I was not aware of until بلشت intern year. وأنا كمان في ناس شفت أسئلة community versus academic versus university. Honestly when it comes to surgical specialty you don't get a choice. You go to where you go in. يعني yes I had interviews in both university و community وبالعقلية اللي كنت فيها لما I applied للresidency أنا كنت بدي because I loved academics and I wanted to pursue academics حطيت university programs أعلى. بس هلا after I'm doing my training the program that I'm in is an academic place but it's a community hospital. But the training that you get surgically as hands-on sometimes community are even better than a university program. Again, I'm not speaking on all programs, but I'm بحكي something to keep in mind. It doesn't matter. يعني we're not at a position نقدر to pick and choose where we're going to go, especially for surgical specialties. That's what you need to keep in mind.
Yeah, as you can see, الطريق طويلة, but ultimately it's worth it. It's rewarding. If that's what you want, we recommend. I bet we all agree that we recommend that you continue to go
So-
after what you want.
Raheem, just one important thing, because someone texted me this question on direct message. Is like, it's very important for people who's not doing their residency outside not to fall in trap for international fellowship positions. So a lot of programs in ortho, in urology, in ENT, all these subspecialty big programs offer something called international fellowship. So these are international fellowship. You get sponsored by X institution or X university. You do observership there. You don't touch patients. You have like, you don't have real surgical experience in the US, and you come back to Jordan. Okay, you can get a job in Jordan, but it's not enough. You cannot have like options to stay in the state like Walid and Osama, or to move to a consultant position abroad. So this is very important, and it's not worth it to fall in trap and go for international fellowship position, even if it is a prestigious institution.
Good to know. A couple questions about the AUA match and signaling. Mohanad, any?
Yeah, I did read something about that here. So AUA match is called an early match, which means you apply at the same time as other programs, but the match comes out in Mush March. It's called an early match. What does that mean? That means you hear your results back before other programs do. Benefit of that إنه الناس اللي مش عارفة and they're not 100% wanting to do urology, meaning if they don't match this year, they are willing to take another specialty, is you can apply to other specialties who still interview, لأنه their interview season will still be going on at the same time that the match comes out. Then you can decide if you want to rank programs for the official March match. So if you apply to general surgery prelims, you apply to any other specialty, then you can do that. Signaling, I think it's in other specialties, but it's a new thing in urology they tried. What it means in an applicant, before once they submit their application, they signal a certain number of programs. I am very interested in you. They tried it قبل كم سنة in urology. Clearly, it's going to become the standard. And this year they increased it to 30 signals. So any applicant can signal 30 programs saying, I'm very interested in applying to your program. They see this before they offer you an interview. I think I initially فكرت شيء هبل, but now I think it's going to be very important. Now that I'm faculty, I hear the conversations on the faculty level about signaling. أعطيكوا الصافي, if you are not signaling a program, I think a majority of them will not offer you an interview. It has the way the programs see it, and if we don't get one of those 30 signals, then the applicant is not that interested. So when it comes to time to ranking us, حتى if we interview them, they're not going to rank us high. ما بعرف هاي بتوفر على الناس مصاري, لأنه you're, instead of interviewing لمليون program, you're only signaling 13 واحد. بس I think it's not good للIMGs, لأنه بعدين هيك it restricts you إنه بس رح تبعت ل 30. طب مين ال 30 رح تبعت لهم؟
Yeah.
I don't know مين في IMG friendly, who's not IMG friendly, which does not exist with urology. That's signaling.
Yeah. مشكلة. We have signaling in general surgery too, started this year and last year, and it's extremely confusing for IMGs because, as you said, and I would signal الميت program اللي أنا قدمت لهم, like I really want to go to any program. Okay.
غنيم, بس في عندي كومنت حدا كاتب معنا, I'm kind of lost, how can I know all about the details. النصيحة الوحيدة يعني أنا عارف أنا وكيل ميديكال ستودنت هون, أنت في عندك رود ماب طويلة, ما تفكر بالرود ماب as a big picture وحدة, أنت فكر بالنكست ستيب, يعني focus on your next step.
Yeah.
أنت medical student right now, think how to finish your steps, think how to build your CV and build connection.
Yeah.
At the end, next step you think about it. فهاي أهم نقطة. التايم management is very important. هاي السكيلز مش موجودة عندنا. I think إنه الميديكال student they should build that.
And then
I
a
agree.
couple questions. Sorry, Willie, go ahead.
Yeah, I just feel that we're wrapping up, so I just want to add something before we finish, because this is a question that I always get. Everyone asks me when you apply for a fellowship on the SF Match, should I apply for any specialty? مثلا يعني pediatrics, oncology, spine, sports medicine, adult reconstruction, because this is what 90% of people do, and actually I am against it. أنا بحس إنه هون لأنه أنا I was a part of selecting the fellows last year, I saw how they did it. Okay, يعني ما بحبوش الواحد يكون all over the place، يعني يجي مثلا البيرسونال ليتر تبعته او مثلا الايميل او whatever، يعني انه انا بدي اي شيء، يعني بس اي فيلوشيب مشان الله، يعني انا بس بدي اجي هون، هذا شيء، هذا اتس بيج نو، يعني هون بالنسبه لهم بيعتبروها اتس بيج نو. It's like a jack of all trades but a master of none، يعني هم هيك بيعتبروا. فانا بنصح اللي بده يقدم للفيلوشيب دائما يكون سيلكتيف، يعني مثلا يدخل اذا بده، ما بحكي يختار one sub specialty، لا pick two بس يكونوا لهم علاقه ببعض. يعني مثلا انا I picked orthopedic oncology زائد arthroplasty، they mix very well together. You can mix specialties، مثلا you can go pediatrics and spine مثلا، they mix very nicely. Okay. فيعني الواحد يكون عنده common sense لما يبعت دائما، يعني مش انه يحسسوا انه انا I'm desperate وانا I just want to come over here I want to do it. لا، احنا كثير كويسين واحنا كثير واحسن منهم كمان انا بعتبر، يعني وريزيلينت، يعني وعندنا كثير potential، بس احنا لازم نوريهم هذا الشيء، مش نبينهم انه احنا مساكين وما شاء الله تعالوا بدنا نيجي احنا وكذا وفور the immigration purpose وكذا. هذا big no. فهذا شيء كثير مهم بالابلكيشنز لما الواحد يبعثها.
Well, even if you are desperate, بيني وبينكم, you need to make it look like you're not. You need to make it look like, oh,
Exactly,
I'm very passionate about orthopedic trauma. I live and die and dream of orthopedic trauma, and this is the only thing you need to, هم it's true. هم هيك medical students من day one بيكونوا بيفكروا ايش بدهم يعملوا. كل السي في تبعهم is geared toward one specific specialty. So you need to make it look, it needs to be convincing. Okay, more questions about visas that we will answer in our separate visa session. I think كلاتنا وسعنا راسنا من الفيزا. It's very complicated, but hopefully we'll try to answer all your visa related questions in that specific session. A couple questions about doing research بالأردن. Is it مفيد? Is it مش مفيد? I'll let you guys answer too, but from my standpoint, I'd say any research is better than no research. If you have something on your CV, I mean, when you're applying for research positions here, they tell you, send us your CV. You want to have something on your CV. So like Mona and I did a project اشتغلنا كتير عليه, and ultimately it went to nothing. But we both حطينا على السي في تبعنا اشتغلنا عملنا OB research project. So any research, any statistics course, anything that you can add on your CV and truly learn something from is beneficial.
لأنه when you're approaching maybe you don't know, when you're approaching somebody, any attending or sending an email telling them I'm interested in research and I want to do research, okay, show me what you have done. يعني لأنه one of the things that my mentor, when I met her and I told her أنا بدي أعمل residency بالUS, I did my step 1 score and I want to do research once I graduate. قالت لي have you done research before? قلت لها yes I have, and I have X, Y and Z. فإذا أنت already قاعدة بالأردن وما عم تعملي إشي already, it's not like إنه you're missing, بدك to skip an opportunity بأمريكا عشان تعمل research بالأردن. لا، أنت عم بتفضي، you're filling in space, filling time. إذا عم تعملي امتياز وعم تدرسي للsteps, you can still manage to add on a research project to start with. And research also takes time. مش إنه بتعملي research project وبعد بشهر عندك publication. It takes a lot of time to publish. Yeah, زي ما قلتي, better than nothing.
Okay, so I guess we're running out of time. Thank you so much for your time and effort and for being here, all of you guys in the audience. This is just like kind of a taste of how nothing is impossible. وإحنا بالأردن, every single one of us, ناس قالوا لنا it's impossible, you can't do this, you can't do that. This is a great example of, you know, with hard work, with determination, with like grit, you can get into any specialty, you can do anything that you want to do and anything that you work hard for. You know, I never tell anyone you can't match in anything. But obviously, as you saw, needs a lot of hard work. So if you're willing to put in the work, good things will happen. Anything you guys want to add?
I think there was a few questions about OBGYN. They're asking about, should you apply for another specialty? Again, it's up to you. يعني it's more time and more money. And I personally did not apply لأنه أنا بالنسبة لي إذا ما بدخل نساء توليد ما بدخل أي شيء ثاني يعني بغير my entire career path. It's up to you. إذا أنت you're willing to do something else, then by all means. بس
Pretty personal.
a personal question, personal opinion يعني.
Yep. Okay. شكرا كتير لكم يا جماعة. Yeah, thanks. Walid is gonna give you guys his email, and feel free to reach out to any of us who we are just representing people from our specialty. You know, you can always find IMGs and Jordanians willing to help, inshallah, any medical students or residents applying.
Yes, thank you all for this amazing session. Inshallah نكون فدنا الناس.
Inshallah. Okay.
شكراً
Thanks
كتير.
all.
Thank you.
Take
Thank
care.
you. Thank you. Thanks.
Thank you.